Hi everyone, it's Annie from Natural Elements Physio here in Leicester, helping you look, move and feel better. I want to talk to you today a little bit about neck manipulations in particular, and manipulations of the joint. So a couple of questions that have cropped up this week with patients not really sure exactly what manipulation is, and I just wanted to clear up what it is and when we might use it and when we might not use it. A manipulation, when we talk about it as physios, tends to be talking about taking a joint to the very, very end of its range and then passively taking it even further into the end of its very range. So it stretches the joint itself, it will stretch the ligaments and the capsule around the joint. And it's really useful if you get sort of an acute neck pain or acute back pain and you've got one or two joints in particular that tend to be a bit locked up. Manipulations are fantastic for releasing it. But it is quite a high velocity sort of thrust that you do, so it's a fairly forceful technique. So whilst it's very useful for acute back pain, although not back pain that's got leg pain, particularly extending past the knee, manipulation is not the first line that you would use. But there are certain people that you should not manipulate on ever. So if you have somebody that's got a weakened bone, so anything to do with osteoporosis, or if you suspect that they maybe have a little bit of rheumatoid, maybe they've got a long history of taking steroids. One of the things that steroids can do is it can weaken the bone. You obviously don't want to cause any fractures and don't want to cause any damage to any underlying bone, so manipulation is a real no-no for these people. Also, if you've got things like, as I said, rheumatoid arthritis can also damage the ligaments as well, and it can make the neck that little bit unstable. I would be wary about using it with people who are sort of diabetic and acute diabetic, and definitely anybody that's got any kind of circulatory disorders, or it looks as though there may be any kind of circulatory disorders. It is not the first line of treatment for everybody, but it can be very useful. So it gives that nice popping and clicking and cracking. I'm going to see if I can add a little bit of a video on of my son doing it, just so I can show you what they sound like. Hope that clears up a few questions. If there's any other problems, give us a ring at Natural Elements and we'll see if we can help sort you out. Take care and good night. Bye bye.